Dear friends, the Education TV brings you a good news as usual. As of now, the schools are being reopened the world over after a period of about 2 years. It's a great sign that we are overcoming the impact of the pandemic that we have experienced during the last 2 years. Let us hope that the process will continue and we will overcome all impact of the pandemic on the education. As we commence the reopening of schools, we need to take care of so many aspects of the life and the learning process of the students. It's a major task for the educationist to think over the possibilities, put in place suitable structures, build in immunity systems for the children who are under our care. As the whole world is concerned about this issue, I bring before you a well-prepared document of the United States where they have been processing the issue of opening the schools. Please have a look at the dialogue that goes on, the issues raised, so that we all may participate in this concern and put in place appropriate measures in all our schools, and if required, the family circumstances in which these children are living. Wish you an ongoing process of studying, an ongoing process of putting in place serious measures in all our education institutions. Have a look at the video.
Good afternoon and welcome virtually to the White House for our National Safe School Reopening Summit. Last September, I had the chance to visit communities to see how educators were handling the challenges of going back to school. And I met a teacher who was coming to his classroom every day, even though his entire class was virtual. When I asked him why, he explained that he wanted his students to see the room, to understand that that space was special, because it's a safe place to learn and grow, because it belongs to them, even if they can't be there in person. He told me, what educators really do every day is create community. And I know exactly what he means. I teach English and writing, and at the start of the college semester, my students are often shy and closed up. But as time passes, they share their stories about their lives. They learn and laugh together. They root for each other and take risks. They courageously read their writing out loud, sincere and raw, and sometimes heartbreaking. They trust each other because they know this is our community. Over the last year, educators have done so much to keep that connection alive. But teaching virtually just isn't the same. In my class, students don't chat with each other like they used to, after the lectures are over. I can't read their body language to know when they're struggling. And I have so much admiration for those teaching elementary-age children who are tired of screens, but don't have the language to articulate why. Or middle school students who are struggling to find their identities, isolated from their friends. Or high school students missing out on the moments that they are supposed to stay with them forever, like prom and championships and class trips. There are some who have questioned whether or not educators want to go back to school. Of course we do. Classrooms are, where our work comes alive. They're where we can truly connect with our students, where we build community. But we have to go back safely. When we passed the American Rescue Plan, we took an enormous step toward that goal. And today, we're going to come together to share solutions for schools across this country. We're here to listen and learn from you. We're going to support you because we know that's the only way our students succeed. But we also know that this isn't going to be easy. My husband made a commitment to you that we would be open and honest about the opportunities and challenges of reopening schools for in-person learning, which is why today is just the beginning. We aren't going to get this right, but we're always going to work with you. We're going to be transparent with you, and we're going to earn your trust, just like you do for your students every day. Recently, I've been touring schools to see what's working and what's not. And I had the chance to visit a school in Concord, New Hampshire. I met some of the kids who are coming in part-time, and I asked this little fifth grader what he had learned, about himself during the pandemic. And you know what he said? He said, I can do stuff that can be hard or difficult. If you're stuck, then keep going. So many educators have felt stuck this year, but we keep going. It's what we've always done. When the classroom budgets run out, when children can't focus because they're worried about their families, when the lesson plans go wrong, we find a way to push past the chaos and build something beautiful. We never stop learning. We never give up on the students who need us. And together, we will rebuild our schools and create the communities our students need. Thank you.
Thank you. Thank you, President Biden, Vice President Harris, Dr. Biden, and Dr. Rochelle Walensky. School districts, leaders, parents, educators, and students, our students, who are part of this summit. We learn best from one another. We know that. We know students learn best from students, teachers from teachers, principals from principals, superintendents and state leaders from each other. We know that. That's why we're here today. I'm Miguel Cardona, and I'm honored to serve as the Secretary of Education. I'm not only here as an educator, but as a father of 2 high school students, husband of a family school liaison who visits middle schools daily, and brother to Marisol, a school social worker in Florida. I know how hard this work can be. I want to share quickly a story called There Is a Rainbow. It was shared with me by Teresa Trinder. She wrote the book. She's a parent, and her son Charlie had a hard time when we had to go fully remote last year. And it was a very difficult time, as it was for all students across the country. And the students in this neighborhood in New York, they made paintings of rainbows, and they put these paintings on their front doors or on their windows so people in the community could see it, to provide hope. These rainbows provided hope. And at the end of the story, the school doors open and students are able to go back, and Charlie's able to go back to school. So the school is that rainbow. Today, we're going to be talking about rainbows. The National Center for Education Statistics share that over 45% of our elementary and middle schools offer in-person learning daily. About 75%, or 3/4 of our schools, are offering some form of in-person learning, including hybrid. That's a great start. We must continue that so every school, K through 8, offers in-person learning 5 days a week. I want to give a quick shout out to those districts that have really been doing this work well. Shout out to Dallas, Texas, and Michael Hinojosa for your leadership. Arizona, I love the progress you're making, and you know I'm not going to go too far without giving a shout out to Connecticut. Thank you for having the doors open in many places since day one. Thank you for your passion and your urgency. We still have work to do, lots of work to do. You know, we know there are inequities to in-person learning. Only 28% of Black students are going to school in person daily. 33% of Latino students are doing it. And only 15% of our Asian students are going to school in person daily. That's compared to half of white students that are doing it daily throughout our country. And we know students with disabilities lack access, and the effects of the pandemic and remote learning have impacted them so greatly. America, that is our charge, to safely reopen schools as quickly as possible. The American Rescue Plan provides $130 billion to help get this work done. With that money, we can address those inequities that I just talked about. With that, we can safely reopen our schools. And we have to act wisely and with urgency to get it done. As the First Lady mentioned, shout out to the teachers, educators across our country who've fed children, provided that social emotional support, have driven children as bus drivers. You're doing the work. I'm proud of what you're doing. I'm proud of the commitment you're showing. It doesn't take a pandemic for us to appreciate our educators, but I'm really proud. I want to say thank you. And that's what today's about. I want this to be a conversation. Panelists, I want you to be thinking about your audience, are your colleagues at work, your friends. This needs to be a conversation, an authentic conversation where we learn from examples and we learn from mistakes. That's how we're going to learn best, when we're open and we're honest about what's working and what's not working. You know, my experience in Connecticut as a former commissioner of education, one of the things that I learned is partnerships matter. And one of the partnerships that really helped us reopen schools safely was the partnership with the Department of Public Health. Deirdre and her team over there, we worked hand in hand. We talked so often about how to do this and how to be transparent, how to make sure that health and safety drive every single decision we make. So I'm honored to introduce the next speaker, who's a partner. And she's going to be speaking now, but at the national stage, we're going to make sure that those partnerships continue. And my partnership with Dr. Rochelle Walensky is going to be strong. So it's my honor now to introduce Dr. Rochelle Walensky, who leads the Center for Disease Control, who has a few remarks. Dr. Walensky?
Thank you so much. I'm so honored to be with you today, to join the President, the Vice President, First Lady, and Secretary Cardona, as well as all of the teachers and staff and students virtually here with us today. I want to say a special thanks to Secretary Cardona and the team at the Department of Education. They have been steadfast partners in this critical work. To the school teachers, leaders, staff, and students, I want to share my heartfelt gratitude for your innovation and true resilience over this past year. You have successfully navigated unprecedented challenges in how you teach and how our students learn. As a mother of three, I too have experienced the challenges and uncertainties within my own family, and it's not easy. My son's back to school night happened right after I was nominated to be the director of the CDC. I heard from his history teacher about how hard it was to engage students on Zoom, and from his other teachers about how hard it was to do biology labs on Zoom. This experience was front and center for me as I took this role at the CDC. But today I'm hopeful because of the opportunity we now have to get our children safely back to in-person learning. The hope is based on real-world experience, evidence, and science. We know the significant benefits the classroom setting and the support services delivered by schools provide to our students, especially to those from low-resourced communities, racial and ethnic minority communities, and those with disabilities. As I have frequently said, CDC believes that schools should be the last place to close and the first place to open. You are so vital to making that happen. And now we have the data, the science, and the resources to make this a reality for all of our schools across this country. Most importantly, your bravery, your creativity, your fortitude represent the real world evidence to show that this is truly possible. In every aspect of responding to the COVID-19 pandemic, science must lead the way. At CDC, before we develop and disseminate any guidance or recommendations, we conduct an in-depth review of all of the data available and evidence. That process was the foundation of our operational strategy for K-12 schools through phased mitigation, released first on February 12th. As we developed the strategy, we also engaged with our educational and public health partners to hear firsthand from parents and teachers about their experiences and their concerns. I personally engaged in roundtables and heard the anxiety expressed by both parents and teachers, anxiety about children's educational milestones lost, and about personal and family safety. Understanding their perspectives was central to crafting a strategy that could be implemented in schools of varying shapes, sizes, and resources across this nation. Ultimately, our strategy was built on the evidence that showed that K-12 schools could safely open for in-person instruction and stay open when they implemented a complementary set of mitigation strategies. A key principle of the strategy we called phased or layered mitigation. We recognize that while all mitigation strategies provide some level of protection, the greatest protection is provided when they are layered or implemented together in the event that one might be broken. This is important because the risks of COVID-19 spread associated with lapses in one strategy, such as breaches and mask wearing, are lessened when there are other mitigation strategies in place. CDC recommends specifically 5 key mitigation strategies: universal and correct mask wearing, physical distancing, hand washing and good respiratory etiquette, cleaning to maintain healthy facilities, and using diagnostic testing and rapid and efficient contact tracing combined with isolation and quarantine in collaboration with our local health departments. In particular, we emphasize the importance of universal masking and physical distancing along with cohorting or using pods to minimize exposure across the school environment. When we released the operational strategy, I stated that CDC would follow the science and would update our guidance quickly as new evidence emerged. In our initial strategy, we recommended that physical distancing should be at least 6 feet between people based on available evidence at the time. And to no one's surprise, we quickly heard that this was a challenge for many schools, given their current physical layout and the number of children in some school communities. Since the initial release, CDC scientists have been actively reviewing the latest science and conducting their own studies to expand the evidence base, including that evidence on physical distancing. We are grateful for them moving so quickly to produce new evidence that we could act upon. Last Friday, in light of a series of studies recently published, CDC updated its recommendation for physical distancing between students in classrooms. Specifically, in elementary schools, CDC now recommends the student remain at least 3 feet apart in classrooms where everyone is wearing a mask, regardless of the level of COVID-19 risk in the community. In middle and high schools, CDC recommends that students remain at least 3 feet apart in classrooms where everyone is wearing a mask and the level of community transmission is low, moderate, or substantial. Because COVID-19 spread is more likely among older students, CDC recommends that middle and high school students remain at least 6 feet apart in communities where COVID-19 risk is high and less cohorting is possible. I want to emphasize that these recommendations are specific to students in classrooms with universal mask wearing. In all other school settings outside the classroom and between students and adults, CDC recommends at least 6 feet of physical distancing. We believe these updated recommendations are another important step to getting our children back to in-person learning. CDC is committed to partnering with you in this effort. Recognizing that recommendations can be complex, CDC has released a series of online resources and tools for schools on our website. And we continue to conduct webinars and stakeholder engagements to increase awareness of the strategy and to support its use in planning efforts for school openings. All of these actions build on our ongoing work to support teachers, school staff, parents, and students, as well as our efforts to provide guidance, tools, and resources, and to our educational partners need to get our nation's schools open as quickly and safely as possible. Last week, CDC announced its plans to invest $10 billion to support COVID-19 diagnostic and screening testing for teachers, staff, and students, an additional mitigation strategy to support safe school reopening. And throughout the month of March, we have been engaging with teachers and school staff to help them get vaccinated through the more than 9,000 pharmacies in our federal retail pharmacy program. Participating pharmacies are now prioritizing vaccination appointments for educators and staff who work in K-12 schools. Encouragingly, one recent study suggested that 50% of our educators had received at least one dose. If you have not been vaccinated, I encourage you to go to cdc.gov to learn more about how you can sign up for an appointment through this program. Before I close, I want to acknowledge that the decision to return to in-person learning is not one I take lightly. As a parent, I know this may be one of the hardest decisions you have to make since this pandemic began. My youngest son recently returned to hybrid school about a month ago. Last week, he said to me, "Mom, it finally feels like I'm in school again." I'm so glad he's back. He's looking forward to his high school graduation next year after a year of support of our children who are our future. I look forward to this important dialogue and to learning from you during this entire day together. Thank you.
I'm Kathy Hoffman, Arizona Superintendent of Public Instruction. And while this past year has been incredibly challenging for our education community, I finally feel like there's a light at the end of the tunnel. And with declining COVID cases, teachers getting vaccinated, I am hopeful that by the end of March, almost all of our schools will be open for in-person instruction. And I've already heard about students coming back from their spring breaks, so excited to be back at school, back with their friends and teachers. And I expect that we're going to continue to hear a lot of these happy stories. Although it's still going to look like school during a pandemic, it feels like a weight has been lifted. And I'm very optimistic that our school communities are going to have a very strong end of the school year.
Thank you. And thank you, Dr. Walensky. Your kid will walk the stage next year, and so will mine. We're in this together, and I appreciate your partnership. And thank you for the vaccination and the surveillance testing. We know that's needed. Thank you for your support. I'm really excited to begin our first panel, Implementing CDC's K-12 Operational Strategy to Keep Students, Educators, and Staff Safe. Lessons from the field. I'm really pleased to welcome our guests from the Cleveland Metropolitan School District. We're joined by Eric Gordon, Chief Executive Officer, Sherry Obrensky, President of the Cleveland Teachers Union, Aaron Creel, Facilities Manager, and Trayvon Edwards, a Cleveland Metropolitan School District graduate and a current district intern. Can you all start by giving us a few minutes about how you approached reopening?
Thank you, Secretary Cardona, for having us today. Really, we focused on three key things in our reopening. The first is being acutely aware of who our community is. We're 86% children and people of color, 100% poverty, and the highest childhood poverty in the country. Many of our families and caregivers are frontline workers working in the healthcare system, which is large in our community, and in restaurants and in cleaning and things that put them at higher risk. And understanding that we have long-standing health disparities that existed before this that provided extra risk, which told us to use a cautious reopening. The second was paying not only attention to physical safety, but to social emotional safety. And that meant not only outfitting our buildings with the right PPE and mitigation strategies, but making it really visible and transparent. And so we videotaped buildings so people could walk through virtually to see what that building might look like. We had school-based safety teams that did virtual, did walks through the school so that they could provide comfort to their colleagues and to their parents and students. Lots of messaging to our community, and really investing in some of the extras that maybe weren't absolutely necessary for physical safety, but sent signals of emotional safety as well. And then the third and final was to collaborate. We have 9 labor partners and a principals association, as well as our community, that have been engaged every step of the way. Because while it's easier sometimes to go do it yourself, it's more effective in the end to do it together, despite all the wrestling it took to get that done, which has led us here in the last several weeks to open up very, very smoothly as we've returned our students to hybrid learning in Cleveland.
Thank you for that. Thank you for that, Eric. You mentioned wrestling. Listen, this has been hard work. This is the first time we've ever had to do this. So it is different. It forced us to think differently. And one of the things that I want to hear about, and Sherry, this question is for you. How have you worked with the district and the educators to collaborate and to make it work despite this being unprecedented and having to wrestle through it? Tell me about that.
Well, first of all, thanks for having us here today. We appreciate the opportunity. We made a concerted effort from the very beginning to really work together very closely and collaboratively as we dealt with the closing of schools, and then as we were working through being fully remote when schools reopened this fall, and then as we're moving into this hybrid period with getting our students physically back to school. We meet continuously. We have groups that represent different stakeholders within our district coming together to problem solve, to come up with all of the solutions that we have, to do the messy work of talking through the challenges and figuring out how we can get to the other side. And we have really appreciated the collaboration and partnership. I actually came to be the president of the Cleveland Teachers Union at the very beginning of the closure period. I'm just coming up on my 1-year anniversary. And even though I'd been in leadership for a long time, Eric really worked with me and to develop that partnership so that we could lead together throughout this time period, and making sure that the boots on the ground, that we had a voice in how we were doing the work. It was so critical to have the voices of the people who are the boots on the ground, who are lifting the challenges that we see every day, and then helping come up with the solutions that we felt were workable, not only so that we had practical implementation, but also so that we were building that security among the staff to feel that they were equipped to come in and do the difficult work that we had to do.
Great. Thank you so much, Sherry. Eric, this question's for you. Can you talk about how you use CDC's prevention and mitigation strategies to help work towards in-person learning?
Well, Dr. Walensky, you really teed it up nicely, talking about the layering strategies that the CDC outlined for schools. We use those as our entry point, and then work very closely both with the Ohio Department of Public Health and here locally, the Cleveland Department of Public Health, to think about what those look like operationalized and locally. We also relied really heavily on our effective professional organizations, the Council of the Great City Schools and Chiefs for Change, who provided us, operationalizing these guidelines. What does it look like? How do you do it? What are the best practices in large urban communities across the country? And together with Sherry, access also American Federation of Teacher Resources. So it was a combination of the science that the CDC provided for us, as well as the practitioner expertise that we were able to quickly assemble and learn together through our networks across the country, that really made us comfortable with the strategies we were implementing.
You've talked so much, Eric, about these partnerships and how key these partnerships are. You have a well-known hospital system in Cleveland, and I'm wondering if you can discuss the partnership you've had with public health in your healthcare community.
Yeah, we're really blessed to have a sizable and important health community here in Cleveland, and all of them willing to help us. We deliberately partnered with University Hospitals, which is a regional research center here in Cleveland, who actually co-developed what they call their school playbook with us. They actually walked with Aaron and Trayvon and others through our buildings, a K-8 school and a high school, and we helped co-design how the building had to be retrofitted in order to be safe for COVID. And then our contribution to their evidence base actually contributed to our regional approach. So our hospital systems were critical, and we were glad to be a small part of influencing the regional approach here as well.
That's just wonderful. For Trayvon, you've vaccinated thousands of staff, 3/4 of your teachers and your principals. So I'm wondering if you can talk to us about the work you've done in the vaccination centers and what that's looked like.
Sure. So first, thank you for having me here on this panel. So before we started vaccinating our staff here, we actually did a walkthrough with our partner, the City of Cleveland, the Department of Health, and the Cleveland Department of Health, to ensure that the clinic had a great flow. So I went over to the public auditorium and gained the logistics of the clinics. Again, to ensure that the flow was smooth there, what worked, what did not work, again, mirror the same thing for our staff, iron out what works best for them, and then go ahead and look at our staff and use again what worked well there.
That's great.
So I was I'm sorry. So I was the pod lead on the vaccine clinics, and that simply is learning all aspects of the vaccine clinic, except for logistician, of course. And I that's the non-medical roles, overseeing the staff clinics, filling in where it needs to be, where we're short with staff, as breaks, if we're short, filling in there. And the only complaint, I believe, Eric, that we got right was that we moved too quick, because from registration to observation was a rough 10 to 15 minutes.
Amazing.
That's amazing. It's interesting how, for the audience listening, I think what you're hearing are some great examples of what works, but you're also probably hearing things that you're doing in your communities, and it's kind of encouraging to hear, okay, we've done something like that. So thank you for sharing those examples. I'm going to turn a little bit now to Aaron, facilities director. Unsung heroes sometimes. As a former school principal, let me tell you, the custodian and the secretary knew more about what was going on in that building than I did. So, I'm glad you're on the panel, and I'm glad you're able to share what you've done to make sure that the schools are safely reopened. I read here 15,000 air filters and 900 air purifiers were a part of the solution. Tell us a little bit about what you did to make sure that the schools can reopen safely.
Okay, hello everybody, and thank you for having me on the panel. Let's talk about the ventilation first. Our approach to this was to change our filters in our more modern buildings, to do more frequent changing, from 2 times a year to 4 times a year. We identified these months, and like you said, we changed over 1,500 filters starting in this past January. We also recognized our older buildings, who doesn't have the modern systems that presented such a big challenge to us. And we went out and recognized these buildings, and we identified them and classified them in 2 different categories. In those buildings, in the occupied space, to mitigate this COVID issues, we purchased over 900 air purifiers that we installed in every occupied space in these buildings, and did things like that. We also recognized in our newer buildings, did things that we could do because we have modern systems like building flushes and things like that, which added additional building flushes at night when students and staff leaves and things like that. Also, we approached the building approach with signage. Using COVID signage was a big role in this. From the time you walk into our buildings, we have indicators on the ground, outside signage from the time you hit the door to keep people distanced, to keep us safe. And with UH Hospital, we really walked through the buildings to identify one-way arrows down hallways, to identify two-way traffic, to really keep the staff at a safe distance. Stairways that was one way. So signage played a real big role in our approach to these buildings. We also did a lot of spacing. One of the biggest challenge was the spacing of our furniture within our buildings. That was a big challenge. We went about that and did furniture moving. Like we had a lot of excess furniture, so we had to find places to put all this excess furniture. So we utilized storage space. We utilized some of the gymnasium areas. Some buildings we even had to remove some of the furniture and things like that. Once we got done with the signage and the occupancy, we also created a smart sheet to help the academic side, just a starting point, so that they can see what we call as the COVID occupancy, how many students that they can actually fit in their room, to help them, give them just a jump start of what they're dealing with for the kids that's coming back in person. So we also created a signage video for our staff. We have such a large district, so getting this information out was very difficult to a lot of folks, and we created a signage video for staff to go over as we placed the staff. And everybody played a great role. The teachers, principals, they all had a role in helping us finalize our occupancy and spacing in our buildings and things like that. One of our other approaches was PPE. PPE was a big role in our building prep. We have hand sanitizers spread out throughout our building in key locations. We have hand sanitizer and other PPE items staged in every classroom for the teachers to use. We created a 90-day drop shipment program, so all of our buildings will receive their allotment of PPE every 90 days. And as a backup plan, we created stockpiles. We call them stockpile sites, where we have these sites spread out, one on the west side, one on central location, one on the northeast side and the south side, where we have PPE as an emergency so that our staff would never, ever run out of PPE. For any emergency, we have a distribution plan to quickly provide PPE for all of our staff if needed. Those are some of the things and how we approached amongst a lot of things with the help from Mr. Gordon and the teachers and principals. So it was a truly team effort to get to this point.
Aaron, it's extraordinary when you think about the logistics that you've been thinking through. So I'm going to stick this one back with you and say, and I know from my own dinner table that, the flow of students through the school has to change, right? So I'm wondering if you have any key lessons that you can convey to others about how you supported some of the refit configuration of flow of students.
Yeah, so as a facility person, and like I said, we really collaborated with the building staff, teachers and principals, because our buildings are so different. They're made so different. We have them all kind of different sizes. The logistics of them are so different. So the key was to communicate with the building staff, get their approach, because they're the ones that have to deal with the flow. And then once we got their ideas and how they wanted the kids, then we sprung into action with our signage. Like I said, we have one-way signage that tells you, from the beginning of school, from entering the front door all the way to the classroom, we have indicators as to which side of the hallway you stay on, which one-way stairway. Some stairways are two ways, and we indicate that with our arrows and signage and things like that. We even have bathroom usage that was signed, and stalls and sinks that was identified that we couldn't use. Another big thing is lunch now. Lunch is now in our classrooms, some in cafeteria, but the majority of our kids will be eating in our classrooms. So that was a big change for us. And so we figure out a program how to support that. We also, on the facility side, to help our staff, we changed our staffing hours. We have our environmental specialists coming in a little earlier now to help our staff with the sanitation duties during the day. And we save time at night to do our general cleaning and our final sanitizing before we leave the building at night. So a lot of this was collaborating with the principals and teachers, and we went on their guidelines, and we really got a lot of information from them. So to really answer your question, you really have to work together to get this done.
That's impressive. Aaron, I just want to tell you publicly, with the world watching, thank you. I can come up here and talk about school reopening. It's people like you that make it possible. Your actions, everything you just talked about, are why our kids and our educators are safe. That's huge. 1 year and 1 week ago, we didn't know what was coming. We didn't know the extent to which it was going to affect our lives. Your job changed totally. And
Yes,
just
that
to
is
hear
correct.
you talk and with confidence about what you did, that's exactly what we need to hear across the country, how these things are happening with people like you who are leading the way, man. I'm so proud. Thank you for your work. Thank you. So Eric, I want to turn to you now. We know during this pandemic, many families chose to keep their children home and learn in a virtual environment for various reasons. And as a leader, you're going to have to make sure that you're providing great education for all students, whether they're in person or learning remotely. How did you balance that challenge to provide learning for all students, whether they're remote or in the classroom?
Yeah, so one of the things I'm most proud of our work in Cleveland is from the very beginning, we were committed that every child was going to have direct instruction from their classroom teacher 4 full days a week, and then using Wednesdays as an asynchronous day, like many other districts. What's different about it is many other districts didn't have full interaction 4 days a week. They often used other things like taped lessons, much more asynchronous work. And so when we moved to reopening in hybrid, that was still our commitment. And we were looking at data that was saying as many as half of our students weren't going to return. The dirty little secret is that as hard as closing was, opening is harder. And so we've had to figure out, how do we keep kids connected to the teacher that they've had and still provide that 4 days of instruction that we committed to, whether the child came back or not. And so with CTU, we work very collaboratively to design teacher teams, where maybe Sherry and I have 2 classes, but now we're going to share those classes so that I may not see my children every day for 4 days, but I still see them 2 days of the week, and Sherry's seeing them the other 2. We actually even broadened those teams sometime to add a 3rd person that was involved. If we had to do assignment changes, we did them within the school, and we tried to provide as much capacity for those reassignments. And we're still working through that because our families are still changing or shifting their decisions in the moment. We've committed to ourselves that we're not successful if 37,000 students have a generally positive response. We will be successful when 37,000 individual students each had a successful response. So we've called our reopening a transition, and we brought students back in phases, including this week, our final phase, so that we can work through these things with our community, which has been extremely resilient, showing high levels of grace, so that we can get every individual student experience right.
That is so very important, Eric. And you talk about individuals, and there are so many individuals that have been particularly hard hit by this. Students with disabilities, students experiencing homelessness, and many, many other challenges. So Sherry, this one is for you. I'm wondering how you've reached out, how you've been able to support those families, those students with really specific, intense challenges.
Well, I think one of the things that we have done throughout the pandemic period is that our teachers and other educators have made special efforts to connect with families. I think that our connection with families is much stronger than it ever has been in terms of our teachers in the remote space, online, talking to parents and students every single day, and really getting to know the families and understand the challenges. And then as we were working on returning in person, prioritizing those students with the highest needs and making sure that we were returning them first, and also providing them with more time in person. So our students with the highest needs are coming 4 days a week. and are in person 4 days a week, as opposed to the 2 days in person and 2 days remote. So that was one way that we were working on making sure that our students that have the most severe challenges are getting the most attention in person. Additionally, we have been a district for a long time that has focused on social emotional learning. And so creating additional training opportunities for teachers as we're returning into this in-person space as to how we address social emotional learning in the time that we are now with the challenges that we have now, so that we can be more effective in person and in implementing those strategies in our classrooms. But like I said, SEL has been a priority in Cleveland for a long time, and we've done that work for a long time. So this is just enhancing that work, brushing up on some of those in-person skills and making sure that we're being cognizant of that when we're in the classroom with our kids. And we know that this is going to be a process. This is going to take some time. We didn't get into, this pandemic crisis overnight, and we're not going to emerge from it overnight. We are going to have to continue working together, plugging away, making sure that we're meeting our kids where they are and getting them where they need to be.
That's great. Thank you very much. I think that was you captured so much of what we wanted people to hear. We only have a couple minutes left, so Dr. Walensky, could you take the last question?
Sure. So I'm just curious from each of you, what one piece of advice you have for all of the districts out there that are striving to get to where you are. What piece of advice would you offer for them?
I'll go first. I'll jump in. So I think from my perspective, the best advice that I can give is that it's really important to bring all voices to the table and continue to work together, even though the work is messy and difficult. And sometimes you're not crazy about everybody that's sitting around the table. You get angry with each other and it's tough, but it's so worth it on the other side when you are working together, doing this difficult work to get to a place where you're doing a great job for kids and their families.
Eric, do you want to go next?
Thank you very much to all of you for your participation. You were amazing. I know we have a couple others that are going to add. So share with us briefly, what were those things that you want us to know?
Trayvon, looks like you're going to weigh in here.
Yes, so with such large district, I believe that communication is key for any organization, that is. And all team members, no matter position, put 115% in and keep the students in the forefront. If that is the case, then I believe that success will fall right in your lap.
I think Trayvon probably said it best for all of us.
Mm-hmm. And I would like to add to be flexible. As facility guys, we are so routine regiment, and this was all new for us. And being flexible was very key. It was a lot of changing, and for facility guys, that was difficult, but we did it. And everybody, for the most part, I'm so proud of CMSD, was very flexible.
I want to just thank this extraordinary panel from Cleveland for all the work you've done, for the example you've demonstrated, and for teaching us how we can get to where you are. So thank you very much. We'll continue our conversation in a moment.